Gail, how you doing? Hey,
Good afternoon. How are you? Nice to see you.
Good, good. Everybody good?
How are you?
Okay.
Nice to see you.
I want to start by thanking the extraordinary professionals here at Bellevue who do amazing work for the city, everyone in health and hospitals all over the city for everything that they do. I came in here and was reminded of what I think was one of the city's finest hours, certainly in recent years, when we faced the extraordinary challenge of Ebola. And this hospital was the front line. And I've never seen more professionalism. I've never seen more resolve, and a sense of everyone looking out for each other and looking out for all the people in New York City. It was an extraordinarily difficult moment, but everyone at Bellevue handled it as well as I think any human beings possibly could. So when I come in these doors, I feel that I'm on hallowed ground. And we're here because this is the front line again, but for a very different kind of challenge. Right now, we as New Yorkers are watching as the rights of women are under assault all over this country. And this does not conform to our values as New Yorkers, nor our values as Americans. We are seeing rights that were hard fought being taken away from women. The right to control their own bodies, the right to make their own decisions, literally being taken away before our very eyes in state after state in this country. There are women here and in every corner of this nation that fear their rights will be taken away and may never come back. And we do not accept that here in New York. I know a majority of Americans don't accept it. We're here today because the war against reproductive freedom has come to our hospitals. The forces out there that want to deny the rights of women are now using, I think, the most nefarious tools they possibly could. Unfortunately, the Trump administration is doing their bidding. Trump administration has decided that it is better to take away funding for health care rather than respect the rights of women. The Trump administration's rule has effectively, the gag rule has effectively called for the censoring of our doctors and our nurses, literally makes it illegal for healthcare professionals to tell patients what their options are, what their rights are. Literally would stop healthcare professionals from counseling a woman as to her right to a safe and legal abortion. This is as cynical as it gets, taking away money that would help people to be healthy because our doctors, our nurses, our healthcare professionals simply want to be able to tell the truth. These professionals here, and I want to thank all of them for the extraordinary work they do, they took an oath to protect the health and the lives of people and to be honest with their patients. The oath they took requires them to tell their patients the whole truth, not to be censored by their government. And I know that these professionals believe that they have answered a higher calling. Nothing is more important to them than their relationship with their patients. And they are not going to let the federal government stand between them and the people they are here to serve. So New York City is stepping in as of today so that our healthcare professionals can keep that promise, can live up to that oath. Our public hospitals will continue to give full reproductive care, and that includes information about abortion and access to abortion. No healthcare professional in our public hospital system will be prohibited from giving honest and truthful advice to their patients, period. I want to thank the leadership of Health and Hospitals, Chief Executive Officer Dr. Mitch Katz, and our Chief Medical Officer, Dr. Michelle Allen, for their extraordinary leadership, and a thanks to their entire team and all the good people who work throughout the health and hospital system. And I want to thank our allies in this fight, elected officials who have spent their entire lives standing up for the lives of women and the rights of women. Borough President Gail Brewer and Council Member Helen Rosenthal. So here are the facts. In February, the Trump administration issued this gag rule. And we in this city, we fought it. We fought it in the court system every step of the way. We organized other cities to join with states around the country to stop this gag rule, which literally takes away the rights of our medical professionals to tell the truth. Last week, unfortunately, the Ninth Circuit Court of Appeals said that the gag rule could move forward. Now that means that federal Title X funding recipients will be subject to the gag rule. And hospitals and clinics will be held liable for financial damages if they provide information about abortion. That's how total and absolute this rule is. Let me put this in perspective of New York City. There are 75,000 New Yorkers who rely on the health and hospital system for reproductive health care. We will protect all of them. We will protect all patients, and we will protect those who treat our patients. And therefore, as of today, the nation's largest public hospital system will no longer accept federal Title X funds. We won't accept federal dollars if it means denying New Yorkers health care. We in New York City will cover these costs as well. And this is not a decision we take lightly. It's a sad day when our federal government is trying to undermine public health care rather than support it. But it's what we have to do to protect our people. This directive I'm holding in my hand, this is a formal directive issued by Dr. Katz to all the professionals in our health and hospital system. And it's a very clear, powerful message. It says nothing will come between you and your patients. This is our formal directive to all the people who work at health and hospitals to let them know they need to continue on their mission, and we will not let the Trump administration interfere with the work they do. I want to say to all New Yorkers, but particularly to those who see their rights under assault today, to women, to transgender New Yorkers, to nonconforming New Yorkers, to so many families who right now feel that they are under assault. I want to say in New York City, we will stand by you. Here in New York City, we will protect you, we will serve you. Nothing will stand between you and the health care you need. Just want to say a few words in Spanish. El gobierno del presidente Trump está censurando a los médicos al impedir que hablen con sus pacientes sobre el aborto. Por eso, rechazamos los fondos federales y estamos garantizando el derecho a servicios de salud reproductiva en nuestra ciudad. No vamos a permitir que nada se interponga entre los pacientes y la atención de salud que necesitan. I want you to hear from one more speaker, and she has literally devoted her whole adult life to healthcare equity. I didn't know her before I first interviewed her almost 3.5 years ago, but what I came to know very quickly was this is someone who is the definition of a public health leader, and she has fought for reproductive care rights and has fought to make sure that patients are always told the truth. I know for Dr. Blasio, this is a day that probably we never believed would come in our country when these rights would be undermined by our federal government in such a cynical way. But I also know that for her, this has been a lifetime of fighting for the right things. She's made a huge, huge impact over these last 3.5 years here in New York City. We will miss you as you prepare for another chapter in your life. I know you got a little more time with us, but I want to say a profound thank you for your service to your native land. Let's give Dr. Blasio a great round of applause for that. And I know you are going forward to continue the fight for reproductive rights of all women. And your timing couldn't be better because that fight has been enjoined at the highest level ever. And we're all going to fight shoulder to shoulder. My pleasure to bring up our Deputy Mayor, Dr. Herminia Blasio.
Thank you, Mr. Mayor. Thank you so much for the privilege and the honor that it's been to stand not quite shoulder to shoulder, more like shoulder to belly button, all of these years on such important work. It is my homeland, and the honor of a lifetime to come back to New York and to work in an administration that every day is fighting for New Yorkers. And this is just another example of the deeply meaningful experience that it has been to work alongside you and with my amazing colleagues in this work. For that, I'm deeply appreciative. I have had the pleasure of also knowing some other fearless leaders, and my colleagues are here today, Dr. Katz and Dr. Allen, in this work. And thank you, Madam Borough President and Councilwoman Rosenthal, for this, for your longstanding support, both during and for your welcoming me during my tenure here. As you heard the mayor say, in New York, we believe that all New Yorkers have a right to receive the care they need when they need it. Standing here against this gag rule is standing by our commitment to provide guaranteed health care, because we cannot guarantee care that we cannot even talk about. I'm going to speak to you as a physician, as somebody who was, for most of my clinical career, a physician who worked with patients who had HIV and AIDS, where we talked about the most delicate, the most intimate of issues on a daily basis, and where if my patients didn't trust me with this most intimate, most delicate, most sensitive, most personal of information, if they didn't trust me that I was going to be giving them truthful, honest, factually based, scientifically grounded advice, they would not have gotten the care that they needed. They would not have come in to see me. And make no mistake about it, we are standing here today saying to our patients, today at health and hospitals, as a result of this gag rule, nothing changes. Your physicians, your nurses, your clinicians will be giving you honest, complete, accurate, factually based, scientifically grounded medical care advice about what you need, what reproductive health care services you need, the choice you have to decide when or if to have a child. To all of our patients, nothing changes. As Deputy Mayor, I am incredibly proud to stand here with this administration, fighting yet once again for the ability of all New Yorkers to get the care, the dignity, the truth that they deserve. Gracias.
Okay, we're going to take questions about this announcement, then we'll take questions on other topics. First, on this announcement, yes.
So New York City has 22 organizations that receive about $6.8 million a year in Title X funding. You're going to supplement $1.3 million for H&H. Does your decision limit the other nonprofits, community-based organizations' ability to reject or take Title X funding?
So I'm going to start with the top line and then let my colleagues speak about the mechanics. The bottom line here is we're not going to accept this gag rule in New York City. We're going to make sure that women's reproductive rights are honored, and we'll do whatever it takes. The immediate action we had to take was to make clear that health and hospitals would continue its practice of giving women full information, full access to their choices. In terms of nonprofit organizations and other partners we have in the community, we have to make sure they are made whole as well. I know the state is also working closely with us on that. Who wants to speak to specifics?
Sure. Really, with this statement, we're saying while this gag rule is in effect, we will not be seeking any reimbursement of the Title X services that we provide. We will be providing those services on our own pocket. We are in close contact with all of our providers who receive Title X resources in this area. They are, of course, also very upset by this ridiculous rule. We understand that the state has language in its legislation as a contingency fund to help organizations that need to come forward to backfill monies if they're going to be rejecting Title X funding. But we at the city are going to be using our own resources to backfill this funding.
Yes, Anna.
Apologies if this is a dumb question, but does the public hospital system, does anyone here perform abortions, or you guys just refer? Okay. And about how many are performed a year in the system?
So we do provide abortion services. We provide medical abortions in the first trimester, and we actually go up to approximately 24 weeks. I am not prepared to tell you right now the exact number of terminations that we do provide. I would like to say, with the gag order, as a provider of women's health services and as a physician, the conversations that we have with our patients are very personal, they're private, and they're privileged. We need the freedom to give patients their choices and their options for reproductive health care, the same as would be expected of the patient with cancer. If you show up at a hospital in your doctor's office and you have cancer and you want to know what the treatment options are, the obligation of the oncologist is to tell you, the patient, all of your options, and you make an informed decision. The same thing happens with women's health care, no matter what the situation is. If you're a postmenopausal woman having postmenopausal bleeding, if you're an adolescent having your first period, if you're menstruating with dysfunctional uterine bleeding, if you're pregnant and have complications, the expectation from your OBGYN provider is that provider will be very honest with you with the assessment, the management plans, and the potential treatments.
So, what's your name?
My name is Dr. Michelle Allen.
Spell Michelle for them. I think it would help them.
Say that again?
Spell Michelle.
Oh, Michelle is M-A-C-H-E-L-L-E. Allen is A-L-L-E-N.
Thank you. Chief Medical Officer, and let me just add one point on that, look, there's no city that turns down federal funding lightly. This is a moral decision from our point of view. It's wrong that the federal government is trying to undermine the health care of women, and they're trying to tell these medical professionals how to do their job and interfere with the relationship with patients. So to the best of our knowledge, this might be the first time in New York City that the city government is explicitly turning down federal funding because it's coming with such dangerous strings attached. Marcia.
Mr. Mayor, you said that there were about 75,000 women who come to the city's 11 health and hospitals.
There's hospitals and, of course, many clinics as well.
So how does that break down in terms of what kinds of services they seek? I mean, are some here for birth control, or is there a way that you know?
So the major reason women access us for women's health care is for preventive health care, for screening for cancer, for screening for sexually transmitted infections, for pregnancy tests, and for contraception. Those are the major reasons.
Is there a sense that a lot of people would be affected if you were not able to talk to them about their treatment options if they became pregnant?
A significant number of women would be impacted.
And what would it mean to them if they couldn't get the kind of advice that you feel is necessary to give them?
Can you repeat that question again?
What would it mean to them if you were not able to give them the kind of advice you feel is important?
So imagine that we are in another state where there actually are no abortion providers. I think it would be devastating. I would have to defer to the DOH-MH in terms of the exact data on the percentage of women who are pregnant who actually wind up terminating their pregnancies, but it's not an insignificant number.
I guess my question is would they be forced to the bad old days where people were getting abortions in back rooms and the horror stories before abortion became legal?
So I want to make a distinction because there are, in fact, affronts on women's reproductive rights on many fronts, right? This particular issue is around the gag issue, not about the availability of abortion per se. But they are related, right? If you can't give women honest advice at a period where there's stress and decisions to be made, if a decision can't be made jointly with your doctor because that is a person who's helping you come to these important decisions, then you may not know where to get an abortion if that's what you need. You may not know what the risks are of an abortion because your physician hasn't been able to tell you about the risks of the abortion. You may not feel safe going into an abortion because if your doctor can't talk to you about it, how are you going to feel safe asking for it anyplace else? So in terms of the numbers, I would submit that even one person who has a chilling effect and is afraid to have these conversations, that's too many. Women are under assault from every direction here. This is not an accident. These are layering of ways to make it more and more and more difficult for people to get the care that they deserve and that is, in fact, legal.
And hold on, let me get Annie, and I'll come back to you. Hold on, Anna, go ahead.
You can get her. There's not a lot of us.
Fine, go ahead.
I just wondered what your message to New York women is today.
My message to women in New York City today is that we will protect you, we will protect your rights. The federal government is trying to take your rights away. And you know, Roe v. Wade has been the law of the land since the early 1970s. And now we see this right-wing movement that's trying to reach into every corner of America and deny women their rights. We're not going to let it happen here, and we're going to join the fight all over the country to stop it. So if you're a woman in New York City, Marcia, you can come into a health and hospitals facility. You're going to be treated exactly the same way today as you would have been yesterday, regardless of what the federal government has done. Yes?
So just to be clear about the 22 organizations that get 6.8 million, does that include public health, the 1.3 million?
No, the 1.3 million is just for
6.8 is private.
nonprofits that the government supports.
Okay, and to be clear, I don't know if you guys explicitly said this, would you consider funding like the 6.8 million?
Again, the bottom line, as we understand it, and this is all happening in real time, we were hopeful that the injunction that was in place was going to hold and we would not have to deal with this issue at this moment. But we got a surprise from the Court of Appeals just in the last days. We believe that the state budget made provision for this. We need to confirm that. But either way you slice it, we have to keep those nonprofit organizations going. We have to make sure they can provide the services they provide. We hope that the state funding will do it. If there's any other needs, we're certainly going to address it. Willie.
I want to understand from Dr. Katz, this ruling in court occurred a week ago Thursday, and I'm looking at your directive here. My understanding is the ruling went into effect immediately. So what's happened over the last 8 days? Did you send out immediately some kind of directive to your doctors to tell them to continue to discuss abortions? Can you talk about what happened?
Right. Well, after speaking with the mayor and the mayor's office, it was clear that we had support to maintain the tradition of health and hospitals, which is always to provide honest information and to make sure that people had their choices. As the mayor has said, this is real time, right? We're running a health center. We're running hospitals. We get this note from about the court decision, and I have my physicians, nurse practitioners, and nurses wondering, well, so what do we do? So we had to issue in real time, keep doing what you're doing. This is an administration that will support us. So that's why it went out right away.
When did that happen, on Thursday?
Friday. Happened Friday.
A week ago Friday. So what is that called? Is that a directive? How does that go out?
As the Chief Executive Officer of Health and Hospitals, I have the right to direct people, and in this case, the only responses I've gotten from my physician, staff, and nurses is incredible support and happiness to be working at an organization like Health and Hospitals that continues to make sure that women have their choices.
So I have a question for the mayor then. I'm interested in the timing here, because this happened a week ago. His directive went out a week ago, and today we're presented with what you're calling a directive dated today. And I just have a question about the
Willie, let me clarify. Sure.
So you're back today from a campaign trip, presumably departing soon on another campaign trip. What makes this not a campaign event instead of a press conference? Not questioning the validity of the topic, but why are we waiting a week to talk about this?
This is a statement to the people in New York City. And I guarantee you, because we're having this gathering, the people in New York City will hear that their rights are being protected. The internal document is one thing. It's very important. It's part of my responsibility as mayor to communicate to people things that matter to them, and that's what I'm doing. It is, again, I am doing it now because this is my opportunity to tell people what's happening. Anybody else? On this topic, last call. Yes?
You can absolutely assure us that in an alternate reality where you weren't running for president, we would all be sitting here right now in this.
I've had press conferences I'm sorry, my friend. I've had press conferences on topics of every sort long before I was running for president, where I had to inform people of what was happening. It's a nice try, but it just doesn't hold water. Doesn't hold water. Go ahead.
For any of the clinical administrators up there, if you had to comply with this gag order, what would be the ramifications and the repercussions for people in their reproductive health care? Can you give like a tangible example of what happens when women don't know what their options are?
So you're a 20-year-old, it's your first pregnancy. You realize, you're told that your hypertension will result not only in your death, but you lose the child as well. There's a conversation to be had. You can continue the pregnancy. These are the risks. This is how I would manage you. You're in your first trimester. For your own health, you have the option to terminate the pregnancy, and it's your decision. These are the options. These are the benefits, and these are the risks of each of these options. And the patient makes the decision, informed and advised appropriately.
And if there were a gag order in place, I was going to ask Dr. Allen, and if there's a gag order in place, and you have that same, if we didn't have such a supportive administration, and suddenly now you're told, I'm sorry, Dr. Allen, you can't mention anything about terminating a pregnancy because, you know, then we're going to lose money, and we're most focused on money. Then what's your message?
Then the message is restricted. Well, first of all, I'd have to say, Dr. Katz, I don't know any of our providers who would not be honest and truthful with our patients. So it would be irrelevant. What the risk is our going to jail for being honest with our patients. However, if I complied with the gag rule and only told the patient that she would have to continue her pregnancy, if she had pulmonary hypertension, she would die on the table, very high risks. Hypertension, she could have a stroke, suffer from that. And even if you don't die, and we're really dealing with maternal mortality and morbidity across the country and in the city, this patient would suffer a complication even if she lived. So you go through, I'd be able to say, these are your risks of death. This is your risk of having an ICU admission. This is your risk of transfusion. I'm happy to support you through your pregnancy.
Be beyond your expertise, but it would seem that that might open up many clinicians to some type of medical negligence if they're not able to provide a complete spectrum of options.
You're absolutely correct.
Okay, please.
Hi, just to be clear, just to clarify, when NYC Care rolls out in August of this year, will it cover abortion services?
Yes.
And I just also have like an additional thing to that.
It was yes all the way down the line.
So when it does roll out and people can choose to get abortions through NYC Care, how affordable will it be? Because I understand that it's all on a sliding scale. Where does that sliding scale start?
Thank you. So for the sliding scale starts with 0 for somebody who has no money. So our sliding scales are always aimed so that the person can afford it. We don't have any sliding scales that preclude someone getting the services they need. For abortion, but for all our services. We don't, I mean, I think that's the excellent thing. We don't treat abortion as a different service. We treat it the same way we would treat any medically needed service.
Okay, any other questions on this announcement? Any other questions? Okay, let's do other topics. Other topics. Anna.
The Daily News had a story about some teachers in an Inwood school fearing that there's a cancer cluster going on. I'm not sure if you guys are aware of this story, but I wanted to see if the doctors had any comment.
Well, there's teachers who are concerned. We're immediately going to investigate what's going on and address their concerns. I mean, we value our educators. We have to make sure that they are safe and they know they're safe. In terms of, I don't know if anyone here knows the details to speak to.
I do not. We can follow up after.
We'll follow up with you after. Other questions? Yes.
WNYC reported that the lead levels in the schools were 17 times the safe level. And the lead dust is where the high exposure is. The current test that you use, the XRF test, does not test the lead dust. And we found a lot of peeling paint. 700 elementary schools have been built before 1980, and Congress just recently requested that this be handled and made public. Will you test the older schools for lead dust, and what will you do about the peeling paint?
Okay, we test the schools every year, and we'll get you a very specific explanation of the testing we do. In terms, and to date, we have not seen the problems that WNYC is seeing. If we find any of them, of course, we're going to address them immediately. That's why we test every single year. Second, as I said on the radio the other day, we need to know the specific schools where you found problems. We want sources protected. We understand why that's so important. Through whatever indirect means someone can provide us the information of where you're seeing a focal point problem, we want to address that immediately. Our custodians now at the end of the school year are going through every school looking for any particular issues. Again, annual testing, and we have not found, and obviously we have healthcare experts here, we have not found evidence of the concerns that are being raised, but we take it seriously. We'll continue to look at it and do everything we can.
Older schools?
Again, we test them regularly, and I want to get you the full, again, I'm not sure I agree with your interpretation, so I'm going to get to the actual regimen we use so we can all be speaking the same language. Yes?
On Wednesday, you had raised your hand saying that you support Medicare for all. Can you give us some specifics about what your plan would look like? Would it look like Bernie and Elizabeth Warren's, or would it look more like the states?
So as I've said, I'm only a few weeks into the presidential race. I'll be putting out very specific position papers in the coming weeks. But what's abundantly clear to me is the current system is failing tens of millions of Americans, including a lot of people who have insurance and just can't use it effectively. And we have to go in a very different direction. I believe in the universal health care approach, but I'll fill in those blanks in the coming days.
Coming weeks, what's our timeline?
I'll get you as soon as we have it. Marcia.
Mr. Mayor, the PBA is upset about remarks you made during the debate where you talked about the way you had to teach Dante to deal with police officers and your concerns about him. They claim that you haven't learned anything in 6 years about how police operate, and that it adds to a climate where police are not respected. What would you like to say?
PBA has spent decades trying to divide this city. And that's not the members. The members I work with all the time. I know them. I respect their work intensely. But the leadership of the PBA has used divisive tactics for a long, long time. And this is ridiculous. Not only here in this city, for millions of New Yorkers has this been a reality, but around this country for tens of millions of people. That conversation, Marcia, has been going on for decades in this country. And I have an unusual situation. Let's face it, there have not been many white males who happen to have a black son who could speak about what that conversation was like. And if I can play a role in helping people in this country to understand why millions and millions of parents have had to have that conversation, I think it's a good thing to bring out in the open and really discuss and make sense of. The goal is not a negative one, it's a positive one. I honor our police, I respect our police. In fact, what we have done is to respect their professionalism by giving them more and more training in de-escalation, by showing them how they can work more closely with communities. And what I've heard from officers uniformly is that they appreciate the reality of neighborhood policing because community members thank them, community members communicate with them. I don't know if I've said this story before, but after one graduation at Madison Square Garden, I went down into the subway afterwards to go to my next stop. There's a young police officer on the platform. And I often, when I go up to a police officer or start a conversation, I start by saying, how many years do you have on the force? This guy said 5 years. Happened to be a Caucasian guy. I said, where do you live? He happened to live in Long Island. And I said, oh, how's it going? And he said, well, a lot of things are changing. And he said it kind of neutrally, so I didn't know if he liked it or didn't like it. And I said to him, well, what does that mean to you? And he said, well, when I first came on the job, people would not approach me. Now a lot more people are coming up and talking to me. And he said, I think that's good. And I said, why do you think that's happening? And he said, people will talk to you if they're not afraid of you. And it just hit a nerve for me that what we want to create is a culture of absolute communication, mutual respect, teamwork between communities and police. And that's what we're doing in New York City. That's why we're getting safer. So no, I honor our officers. Their jobs are very tough. They do extraordinary work. But being honest about the history of this country and what we have to address is how we move forward. PPA is not interested in moving us forward. They're interested in their own political strategies and games. But this is about having an honest conversation. And when I've talked to people, they appreciate that honest conversation.
Your son would be safer now in the city after 6 years?
Absolutely.
The way the police department has changed?
100%. Every officer has been trained in de-escalation. The amount of restraint our officers show in this city is breathtaking. I believe I have my fact right in saying for 2018 in New York City, there were only 17 instances, adversarial instances, where a police officer fired their weapon. 36,000 officers, 8.6 million residents, 365 days in a year, and only 17 times. You've seen some of the video, Marcia, of our officers holding back and trying to defuse a situation like never before. And now it's captured on body cameras, which is something we've done. I don't have a doubt in my mind, and I've had a lot of folks in communities of color tell me it's different. I've had a lot of young men come up to me and say, I don't get frisked anymore, and I can go about my life. I have no doubt things are different. Yes, Willie.
Let's talk about Che Guevara. What does he mean to you? Do you think that he's an admirable figure? What have you read about him and his life and his role?
I don't pretend to be an expert at all. I only would say this: in the beginning, when he and others overthrew a dictatorship, I think a lot of people in the world thought that something was changing. And then, unfortunately, within a few years, there was a new dictatorship. So the Cuban Revolution went astray. Getting rid of Batista was unquestionably a good thing, but turning into another dictatorship was not. And I think, unfortunately, we've seen that more than once in history.
There's a lot of romanticism on the left around him and the Cuban Revolution. Did you ever find yourself caught up in that? Can you talk about that?
Not the romanticism, but look, again, like a lot of figures in history, you look at them and you see a life trajectory. The beginning, someone who was willing to risk his life to end a dictatorship, who wouldn't say that was something positive, but that's not where it stayed. We'll never know because he died very young, but clearly, look, there's a huge historical tragedy that in the beginning of the 1960s, Cuba could have made peace with the United States and the United States could have made peace with Cuba. And I think Cuba could have emerged as a democratic society with its own values, but still democratic. And I think everyone missed that opportunity. Yes?
Given your studies in Latin American politics and your travel in support of the Sandinistas, why should we believe that you can know the origin of the slogan that you used yesterday in Miami?
First of all, it is a very simple phrase that you can ask me 1,000 times, I'll give you the same answer. I had no idea it was associated with any one individual. Second, what I want to recommend the comment made by Juan Manuel Benitez, that I went to many, many events where that phrase was used with no reference to being about anybody, but just, it's like si se puede, just a statement. Keep fighting till you win. And it's just the reality. I had no idea it was associated with someone. If I had known it was associated, I wouldn't have used it, period. Okay, go ahead, Anna.
So you apologized.
I did apologize, yeah.
I'm just curious, when was the last time you apologized to New Yorkers for something you're...
Plenty of times I have said things I wish I'd done better. I've spoken about the issue of homelessness many times. And, you know, I'll apologize when I think something's wrong. And I do think if you're a leader and you think you've made a mistake, you have to say it. Yes?
You got a lot of blowback over using that phrase. It's a phrase that you hear here in New York City, and it doesn't have the same kind of resonance. You have phrases that you use often, like brothers and sisters, which come out of union circles. Do you think you live in a lefty bubble in New York City, and when you leave it, there's pitfalls for you?
No, first of all, I am who I am, and I'm going to keep being who I am. I say brothers and sisters, you're right. It comes out of the union world. It comes out of the church. It comes out of a lot of places. And it's just part of who I am. And I say it, you know, I'm in the middle of rural Iowa. I say it. It's just who I am. Again, I want to make the parallel, and I'm only going to tell you guys the truth, and you'll interpret however you want to interpret, but I'm going to tell you the truth. If you told me si se puede was originally said by someone in history, I would never have known that either. I have no idea who originated that idea. I just put that in the same category. I thought it was just a general statement. And I don't think that's from some bubble. I just think it's something I had heard lots of places, not just here and lots of other places I've been. I certainly have heard it in the context of many Latin American communities. So I think if someone said, hey, you need to know that was originally somehow associated with Che Guevara, then I just wouldn't have used it. That's that simple. Yeah.
You know, while we're sort of in this topic, what's your current take on Daniel Ortega and his record?
It's a sad situation. It's a very similar, that's one of the examples I give of something that went wrong, and it saddens me deeply. The original 1979 revolution overthrew a brutal dictator. That case, and I want to give a lot of credit to Jimmy Carter, he did not intervene in the way the United States did in the past, and he ensured that that country got to decide its own destiny. But over time, and it was clearly, there were democratic elections and all different than the reality of Cuba, but what we're seeing today does not reflect the values of the Sandinista movement, and it's very sad to watch. And I think he's gotten to the point where his time has come and gone. Yeah.
Mr. Mayor, as you wade into your first national campaign very early on, the blowback from this Che comment, is there a lesson learned?
Well, it's not a Che comment if you didn't know it was a Che comment, but go on.
Sure. Is there a lesson learned so far about the national spotlight as opposed to the local spotlight?
No, again, I find this really aberrant, this particular thing. Now, to be able, if you make a mistake, knowing or unknowing, step forward and say it. I'll give the recent example. I still, to this hour, don't understand why Vice President Biden hasn't just stepped forward and said, you know, I realize what I said about James Eastland has really pained a lot of people, and I shouldn't have done it. I do think as a leader, if you make a mistake, even if you didn't mean it, but you realize it's caused pain, you gotta own up to it. Or if you believe that what you said was absolutely right, you then defend it, great. But to know it's a problem and be unwilling to apologize is strange to me. But in terms of the bigger picture, no, I think we're in the age of authenticity. I think what people want is that you say exactly what you feel. And certainly at the debate stage, I was trying to be as blunt as I could be. I am sure there's plenty of people who heard some of the things and say, I disagree with that, but they didn't wonder who I was and what I believed in. Go ahead.
What steps are you taking to respond to Congress's request concerning the lead in the schools?
Yeah, I just answered that. We are going, again, we don't necessarily agree with your interpretation, but we're going to test everything. We're going to answer it. We're going to answer the request respectfully. We're going to answer the request for sure with a letter. So okay, I can't tell you that because we haven't composed it yet. It's an honest issue. I know, I totally want to say this from the heart. I know that what WNYC did was sincere. I know, from my understanding at least, it was not done with certified technicians. I think that's an issue. I think what we need to do is make sure that everyone understands exactly how we're doing our testing and everything that's covered. That's our obligation to get that out there clearly. Absolutely will respect the request coming from members of Congress. It's not the entire United States Congress, but from members of Congress. Take it very seriously. We had a quote-unquote lead czar for a reason. We have set the goal of obliterating lead exposure in the city once and for all to zero. So of course we take it seriously. And all I ask in return, very politely, is somehow, through whatever channel you like, help us know what schools you are looking at, because that's where we need to go first. Yes?
I wonder how you feel about the debate, how you did, and how will you change for the next debate? Will you employ the same tactics in the next debate?
Well, I'll employ the same beliefs and personality, because that's who I am. Every debate's going to be different. We don't know in each debate who our lineup is. And we don't know how many people are in debate, and we don't know what the ground rules are. They're going to be changing things all the time. I think there was a certain amount of critique of the first one, that there needed to be a little more balance. So, you know, each time you prepare, and I've done a lot of debates, I think you've been at a number of them. Each time you prepare differelly, but it starts with you got to be who you are. Oh yeah, look, 5.5 minutes, that was my total elapsed time. 5.5 minutes is not a lot of time. Huh? Look, it is what it is. I think they can work on creating more balance going forward, but 5.5 minutes is not a lot of time. On the other hand, between the TV and the online viewership, 24 million people is a lot of people. So I'm counting my blessings. If I got to speak directly to the American people for 5.5 minutes and gave it all I got, I think that counts for something. I've gotten a lot of very positive feedback. I think what's really important is that Americans, and particularly Democrats, want to see passion. They want to see true belief. They want to see authenticity. I think I was able to give them that. Anna?
Another cyclist was killed this morning. It's the second this week, and I believe either the 13th or 14th, depending on who you ask, so far this year. A lot of cyclists are really upset at how your administration is handling this. They've done a lot of demonstrations, gathering at where the woman earlier this week was killed. What do you have to say to them?
My heart goes out, first of all, to the families. This is an unacceptable situation. For 5 years and more, we have been implementing Vision Zero. And the idea was to end this once and for all. I took on a very aggressive vision. I didn't say we're going to try and make things a little better. I said Vision Zero. And for 5 years in a row, we have driven down fatalities. This situation here, to me, is unacceptable. We have to figure out how to address it. We're going to throw everything we got at. I still believe the building blocks are the same. More bike lanes, more street redesigns, more NYPD enforcement, and another thing which is going to make a huge difference, which is the speed cameras in the school zones. And we finally have the ability to do those on a really big level. We're going to be doing a lot more. It is a painful reality. It has to end. But there's no question in my mind that Vision Zero has gotten stronger every year. It's going to get a lot stronger before we're done. Well,
Isn't all this an example of the difficulties of doing two things at once? You're a part-time candidate who perhaps wasn't briefed on the local sensibilities and misspoke in Miami. Now you're here today at a news conference.
No.
Doctors working for the city behind you and other officials answering campaign questions. It's very hard to see where the line should be drawn and how you can do both those.
I got no problem seeing the line. I disagree with your thesis. The fact is, and I go back to that question that was asked some months ago, are you too busy and do you have too much responsibility to run for president? I think it's exactly someone who has a lot of responsibility, has an important job, is a chief executive who should be running for president. And I think the demands on this nation right now are such that it would be much better to have a proven chief executive as president. We've tried having an unproven chief executive and it hasn't worked out so well. So, no. That is, you know, I would really love going forward is if someone wants to say, hey, did you misunderstand the local sensibility? I would say, no. Of course I know about the history of Florida and the Cuban community there. Just didn't know the phrase was associated with Che Guevara. Wouldn't have used it if I knew that. But there's no amount of briefing that could say, oh, by the way, if you're thinking of using this phrase, please don't, because it's How is someone supposed to read my mind to know that that's just a phrase that fit the moment, which I was telling these striking workers, keep fighting till you win. The striking workers cheered energetically when I said it. I just thought it was a phrase. So no, that's not about, oh, you should have had more briefing. It's just a misunderstanding. But the important thing, Willie, was once I was told, went and apologized, and it was straightforward. Now, I'm doing this job, this city's moving forward, and I'm running for president. And I think what's important is, and I think it was on display on Wednesday night, you can choose a candidate who has good ideas but has not put them into action, or you can choose a candidate who has good ideas and has actually made them work for people. I think most voters want the latter. Last call. Yes?
Do you support government health care for undocumented immigrants?
Look, right now, what we're doing with NYC Care is we're saying, if you live in our community, we want you to have health care. I don't care who you are or where you come from. If you're sick, it's bad for everyone. So the vision is, if you're in America, if you're part of America, you need support. What form that takes could be a lot of different things. But here in New York City, NYC cares for everyone who lives here, all 8.6 million people. Again, I have to put out a health care plan. I'll address that in a health care plan. I'll address it in a health care plan, but I'm being very straightforward about the thing that I control right here. Couldn't be clearer, my friend.
During the debate here tonight, how would you go to answer that?
It depends on the question. I'm being really, my friend. Rich, you've pitched to me before, I know, in softball. I'm going to put out a health care plan, and we'll address it in the health care plan. But what's very clear is actions speak louder than words. Right here, we're going to provide it for everyone. Thanks, everybody.